We have these warriors who are coming back on their 15th, 16th, 17th, 18th deployments.
All of our guys had traumatic brain injuries. All of our guys have some sort of sleep issue.
Chronic sleep deprivation is a form of torture.
It doesn't just affect the military, it affects all of us.
The emotional regulation, impulsivity, anger management.
You've got a recipe for disaster.
I wouldn't trade my experiences with anything, but I would trade some of the side effects.
These patients typically have gone through years of medications, talk therapy, biofeedback, EMDR, and they haven't had the results that they desire.
And so we started capturing data.
While I was going through treatment at WaveNeuro, every day things got a little bit better.
We're able to help them gain control of their life by using this technology.
Holy shit, these guys are sitting on a human performance gold mine.
So the core technology is something called magnetic EEG guided resonance therapy, or MERT for short, and it's a form of individualized transcranial magnetic stimulation, and we use neurocomputational analytics to identify disruptions in activity and connectivity. And when we see these dysregulations, we can target those areas and try to restore optimal function.
All of the patients will receive an EEG, and with the software, we're guiding that treatment in all those hundreds of billions of neurons to that ideal alpha frequency. And with that, we can adjust the protocol based on how the patient is responding clinically, as well as objectively what we are seeing in that EEG.
So at that point, we reached out to Scott Coda, the command surgeon of SOCOM. Scott went out there and said, look, if you guys are doing what you're saying you're doing, I'm going to give you 5 of my worst traumatic brain injuries. And if you fix 2 of them, I'll initiate an FDA grade trial for MTBI and PTSD. All 5 of those cases that Scott Coda sent out from SOCOM had a net positive effect.
There's a whole host of benefits that we observe. One of the first that is mentioned is patients talk about getting very deep restorative sleep again. But some of the secondary benefits we've been observing are benefits in opioid cravings and substance use disorder.
We have dashboards now built that capture 9 gold standard assessments, common assessments that if you took anywhere around the world, people would understand if they're in that behavioral health marketplace.
To be able to practice precision medicine based on neurobiological imaging is a totally different approach to mental health and emotional health. And I think it's something that every patient deserves, to be able to track this longitudinally over time where you can see with your own eyes, okay, there is a change.
This company really wants to focus on taking the best-in-class industry standards that we have here in the Western world for medicine and sharing that with our key partners on an international level.
That's something that is worth getting excited about, to be able to provide clinically meaningful therapeutic options to populations. That's part of the mission and purpose that we're on this journey with Regulus with, is to increase the reach and expand the portfolio of people who have access to this.